Hey guys, welcome to MedVize TV, where pharmacists like myself give you the information you need to better manage your health and medications. Today's topic, we're going to learn how to use a nasal spray. Now, we're only going to go over how to use the Nasacort and the Flonase. Those are the two most common options that are available over the counter to treat allergy symptoms and congestion. So first step, what you're really going to want to do is super important, get it out of the box. I pre-opened this earlier because I don't know who packages these things, but it's so hard to get out of the box nowadays. Take off the cap. We're going to want to give it a little bit of a shake, get the juices flowing in there. Now, the way you hold it properly, you're going to use the index finger and the middle finger. Goes to the top, thumb is going to go right at the bottom there. So if it's right out of the box, brand new, we're going to want to prime it. And if for the Flonase, if you haven't used the Flonase for more than 7 days, prime it again. And if you haven't used the Nasacort for more than 14 days, we're going to prime that one then. So shake it a bit again. See, like as you can see, there's not much of a spray coming out there. There we go. Now we got a good spray going. Might take a couple sprays there to get out. We're going to use the opposite hand to go to the opposite nostril. Okay, so make sure to use the opposite hand for the opposite nostril. So now I'm going to insert a spray into the right nostril. So I'm going to use my left hand here. One misconception I see about with my patients in terms of how to use their nasal spray, they always tilt their head back. You have to make sure you tilt your head forward just slightly to make sure the medication doesn't drip in the back of the throat, causing a real nasty taste there. And the reason why we're using opposite hand to opposite nostril, we want to avoid impacting directly onto your nasal septum there, which can cause some side effects that we really want to avoid. We're going to breathe normally. I'm trying to simultaneously spray while breathing in. Not breathing too hard in. You don't need to force it. It's a real powerful spray. It's going to get in there just fine. That is in there, okay? And the reason why I'm using it now is because I also suffer from really bad allergies. And after you're done, you're going to want to make sure you give that a nice little wipe down, put the cap back on, and it's going to be ready to go for the next time. Now, quick tip, if you're using this with Afrin, make sure you're only using the Afrin for 3 days. You can use them together. If you are using them together, make sure that you use the Afrin first, because that's going to kind of blast open your airways, and then you can go ahead and use the steroid spray to get, so that way your airways are open and can then get in there and work well for you. If you have any other questions about your allergies or your medications, you can email me at richard@medvize.com. That's richard@medvize.com. That's it for today. Thanks for watching and take care.